We're here with part two, and we're going to go over the second type of medicine that I'm going to be taking. So she's going to go over that with me now.
All right, so the other drug that we're going to be giving you with the adriamycin is the cyclophosphamide. We call it Cytoxan, but you won't see that word anywhere on here. Okay, it's cyclophosphamide. It does treat cancer, including leukemia, lymphoma, and something called nephrotic syndrome. It has brand names there that you'll see listed, but every one of them has cyclophosphamide in it. Okay, this medicine, again, is not right for everyone. You should not receive it if you had an allergic reaction to cyclophosphamide or if you are pregnant or breastfeeding. And some of these statements are redundant. They were on the other sheet as well. So it is an injectable. You're going to receive it here in the Cancer Treatment Center. A nurse or other trained health professional is going to give you the medicine. Okay, your doctor is going to prescribe your dose and schedule. The medicine is given through a needle placed in a vein. Tell your caregiver right away if any of the medicine gets on your skin. Again, drink extra fluid so you will urinate more often and help prevent kidney problems. If you miss a dose, again, it needs to be given on a fixed schedule. So call us if something comes up and you can't come in for treatment, and we'll get you rescheduled right away. Okay. Drugs and foods to avoid. Some medicines can affect how cyclophosphamide works. So tell your doctor if you are also using cyclosporin, etanercept, pentostatin, a protease inhibitor, tamoxifen, a thiazide diuretic or water pill, trastuzumab or warfarin, and I think from our discussion you're not on any of those.
So the hydrochlorothiazide wouldn't count.
It's okay if it's in your blood pressure as part of your blood pressure medicine. We do have people on that and Lasix. Okay, and we prescribe Lasix a lot. Talk to your doctor before you get any vaccines, such as a flu shot, just not while you're on treatment. You're going to be finishing treatment, kind of coming into the flu season, mid-October. So just wait.
Okay.
And we'll.
I know I probably want to get one if I'm going to be around children.
Yeah.
Okay, so I should just wait.
Yeah.
And you said about mid-October.
Mid to end October. Mm-hmm. And you should be good if you wait till then to get your shot. Okay. This medicine may cause birth defects if either partner is using it during conception or pregnancy. So tell your doctor right away if you or your partner becomes pregnant. Women should avoid pregnancy for 1 year after treatment ends. Men should use birth control for 4 months after treatment ends so their partner does not become pregnant. Make sure your doctor knows if you have kidney disease, liver disease, heart disease, or lung disease. This medicine may cause the following problems: infertility, liver disease, kidney and urinary tract problems, heart and lung problems, slow or delayed healing, or secondary cancers. Those secondary cancers are very, very, very rare. Okay, Dr. Manning said he's seen in close to 25 years of practice, just a very couple times that it's ever happened.
What's a secondary cancer?
Like a leukemia or something like that. Mm-hmm.
Okay.
Does that make sense?
Yeah.
Okay. They're very rare, but they're possible, so we have to let you know. Okay. This medicine again may make you bleed, bruise, or get infections more easily. So take precautions to prevent illness and injury, and wash your hands often. Tell any doctor or dentist who treats you that you're using this medicine. And you may need to stop using this medicine several days before you have surgery or medical tests. We hope you don't have to have any surgery while you're on treatment. Your doctor will do lab tests at regular visits to check on the effects of the medicine, so keep all your appointments. Possible side effects, again, call us if you have any of these. Allergic reaction, those are the exact same as on the other sheet we just read over, okay? If you have blistering, peeling, or a red skin rash, we need to know about that. Any blood in your urine or stools or painful urination, chest pain or trouble breathing. If you have dark urine, looks like Coke or tea, or real pale stools, yellow skin or eyes, fast pounding or uneven heartbeat, fever, chills, cough, or sore throat. If you have rapid weight gain, like we talked about in the other sheet, swelling with your hands, ankles, or feet, any unusual bleeding, bruising, or weakness. And then these less serious side effects, again, talk with us when you come in. Changes in your menstrual periods, hair loss, changes in skin or nail color. Some people's nails will get kind of a dark brown or a black. That will grow out, okay? Nausea, vomiting, or loss of appetite. If you have any pain, swelling, itching, or irritation where the IV needle is placed, so that would be around your port. Any sores or white patches in your mouth or throat. Now, both of these sheets say the same last statement. If you notice other side effects you think are caused by the medicine, let us know, okay? And you can call us for medical advice about side effects. And you also can report your side effects to the Food and Drug Administration at that number that's listed there if you choose to do that. Okay? Now you have some other papers that we need to go over in your pile. There you go. The bowel program. This is what to do at home Over the counter if you have constipation, diarrhea, or a sore mouth or mouth sores. Okay. I usually don't read it word for word. You're smart and you can read. The gist of the one with constipation is you can take Citrusel or Metamucil, those daily things to help with constipation. You can take an over-the-counter laxative. That mentions Senecot, but you could use a Dulcolax laxative. Most over-the-counter laxatives are safe if you take them as directed. If those aren't working, certainly you can try milk of magnesia. Doesn't taste the best, but it does tend to work pretty well. Okay. Always, always, always drink a lot of water.
Well, I drink like a gallon.
Okay, that's great. That's great. Maybe you won't have any trouble. Diarrhea, we want you to drink a lot of water with that too. I always tell my patients, go ahead and get a box of the Imodium AD. You can get the generic. It works just as good. Follow the instructions for that. If you have diarrhea, again, lots of Gatorade, broth. Don't drink fruit juice if you get diarrhea because it makes the diarrhea worse. Okay. So either way, constipation or diarrhea, a lot of water. If you get a sore mouth, like your mouth just hurts, or you have little sores in your mouth, mix a tablespoon of salt with a tablespoon of baking soda in a quart jar of water. Mix that up really good. Use it as a rinse. You can do that 4 or 5 times a day. You can swish and gargle and spit that out. If you make a mistake and you swallow it, you'll be all right. It just tastes really bad. Okay. And if those aren't working, we do have prescription medicines for constipation, prescription medicines for diarrhea, and prescription like magic mouthwash to help with those sores in your mouth. But those are some things you can try at home. Okay. Now this sheet, this home care instruction sheet, I like you to keep that by the refrigerator or the telephone or somewhere you can get to it. If you get chemotherapy and you go home and you go, oh, I've got this. I don't know. Do I need to call them? All right, let's look at this list. Okay. The number one reason you would need to call us is fever. We don't like fever in chemotherapy patients. Okay. It's just not good. Her magic number is 100.5 degrees Fahrenheit. If she hits 100.5 or higher, we get a phone call. Okay. And then we'll read through this list real quick. If you have chills, like the I'm sick chills, okay, any unexpected bruising, changes in the color of your skin, reddish or pinkish urine, keeping in mind that that can happen for a day or two after the adriamycin, black or bloody bowel movements, bleeding from your gums or nose, vaginal bleeding, headaches, changes in your vision, or a warm to hot feeling of an arm or leg. If you have a frequent urgency to urinate or a burning feeling when you urinate, like you have a urinary tract infection, we need to know that. Severe cough or sore throat, unusual vaginal discharge or itching, redness, swelling, or tenderness around any wound that you have, around any sore, your port site, anything that looks red and angry and infected. Okay, we need to know about that. If you've got bad sinus pain or pressure, a bad earache, headaches or stiff neck. And I tell all my patients, we all get a headache now and then. We do some Tylenol or Motrin and it goes away. Or some people have migraines and they know what their normal migraine is. If this is a different headache, you think this is not right, okay, you need to let us know. Or if you get obviously a stiff neck. If you have blisters on your lips or skin, okay, big blisters, you're not really going to be able to eat or drink with those, and those are going to hurt. So we need to know about that. If you have diarrhea, you've tried your Imodium and it's just not working. If you have uncontrollable nausea or vomiting, I'm going to give her different medicines for nausea. If she's taking the nausea medicine, she's going to have at least 2 of them at home, and she can't eat, she can't drink. She's just so nauseous or she's throwing up, she can't keep anything down. Please don't let the diarrhea or the nausea and vomiting go any more than 24 hours without giving us a call. If it's in the middle of the week, I can bring her in here. I can hook her up to some fluids, give her a liter of fluid, give her some medicine in the IV, and we can take care of her. Okay. We like to keep people out of the emergency room if at all possible. Okay. I don't want to see you at Saturday in the emergency room and go, what's wrong? And you say, I've been like this for 4 days. Mm-hmm. I'm going to say, why don't you call me? Okay. I could help you. All right. And then if you have any trouble breathing or severe pain, this is our number right here, the 615-6910. We are open Monday through Friday, 8 to 5. You can get a hold of someone. You probably have to leave a message. Our nurse is Vivian. Okay. Mine and Dr. Manny's nurse is Vivian. If you leave a message with her, she does check her messages a couple times a day, and she'll let us know to call you back. You can leave a message with the front desk or call the front desk as well. The way things work in our world is we don't always get sick Monday through Friday, 8 to 5. Usually what will happen is you're going to get sick at night or on the weekend, because that's how it goes, right? And you go, oh my gosh, what do I do? I still want you to call that number, okay? because CareLink nurses answer our phones for us, and one of us is on call 24 hours a day. So you'll be able to get put through to a provider who can help you all the time. All right. Now, it may not be me, it may not be Dr. Manning, it'd be another physician, nurse practitioner, or PA that works here in the cancer center who knows what to tell you to help you. Okay. So you have access to someone all the time. Now, sometimes we'll say, well, it sounds like based on your symptoms, you might have a urinary tract infection. I'll call you in some medicine. You just might need more nausea medicine. Something like that we can handle over the phone. If we can do that, we do that. Sometimes, say it's Sunday afternoon, and we'll just say, I think you can wait. See Kathy tomorrow at 9:00. Just come to the office. Okay. Sometimes we do have to say, you sound really sick. You need to go to the emergency room. Okay. If we tell you to do that, we really need you to do that because we have no other way to evaluate you at that time. Okay, that makes sense. Now, the first time you come for treatment, you're going to meet with two people. The first one is the social worker. One of our social workers will meet with you just to introduce themselves so you know who they are, to let you know some things you're eligible for as a cancer patient. Okay. If you ever need them on subsequent visits, we certainly can call them and have them come up and talk with you. The other person you're going to meet is the dietitian. She's going to come around and talk to you about kind of the do's and don'ts of eating during chemotherapy, good things to eat for nutrition. And again, she can come anytime you need her. Okay. Questions about that sheet right there? No? Okay. The last sheet is the infusion room guidelines. Okay. So we just have a few rules for the chemotherapy room. The first one is she can have one person stay with her the whole time from the time she walks in to the time she leaves. Okay. The person must be 18 years of age or older, and they should not be pregnant. The recliners in the chemo area are for the patients. We do have visitors try to sneak in the comfy recliners, but we have chairs for the visitors. All right. We do provide snacks and beverages for both the patient and the visitor. You'll see the little lounge area. Yeah, you can get anything you want from there the whole time you're here. As a patient, she is provided lunch for free by Friends of the Cancer Center. It's a little box lunch. It's usually pretty nice. Okay. We don't provide that for visitors. Now, that being said, you can bring any snacks and drinks from home that you want. Some people do that. As you go through treatment, you're just like, I can only have, graham crackers and ginger ale. That's it. Okay. I want to bring my own. That's okay. If it's lunchtime and they bring her box lunch and she looks at you and goes, I'm not feeling that today. Mom, please no. Then you can go get her something. Okay. If she just looks at you and says, I need Bojangles. Okay. Or whatever. Okay. Then you're welcome to get your car and go get it and bring it back. You can go to the cafeteria and bring her something. People do that all the time. Okay.
Eat her lunch if she doesn't want it.
Yes, you can. You can eat that if she doesn't want it. People do that all the time too. So just to let you know, you're free to kind of come and go.
Okay.
If she's going to be here for 4 or 5 hours, you don't necessarily have to be glued to your chair. Okay. Now, for you, you can get up. They'll unplug your IV pole. You can go to the bathroom. Okay. We have pillows and blankets. Our blankets are warmer, so they're nice and comfy. A lot of people choose to bring their pillow or their blanket from home as well, and that's okay too. We have some things to keep you entertained, not a lot. You're going to be here for several hours. Most people bring something from home. They bring a book or a crossword puzzle. They do their Bible study. They listen to their iPod, bring their Nook, their Kindle, their computer. We do have wireless access. Just let us know what kind of device you have, and we can get you on our wireless network. You just have to log into it one time.
Yeah.
Thank goodness, because it's about a 50 key
Yeah,
password.
I know. I saw. I was like,
it's long. Yeah, no one's going to hack into that. No one's going to remember it. But then every time you come back, it'll pick up the wireless network. Okay, so all that is available for you.
Yeah, I'm on their wireless on my phone now.
Okay, good.
So I'm good.
So you don't burn up your battery while you're here. All right, so that's chemotherapy in a nutshell. A couple things I want to go over with you before we go over this last sheet that you have. On the morning of chemotherapy, it's a normal morning for you. You get up, take your shower, fix your hair, drink your coffee, eat your breakfast, take your pills, do everything you would do on a normal morning before you come. Okay. If you get lab work done the day of chemotherapy, it doesn't have to be fasting lab work. So I do want you to eat your breakfast if that's what you normally do.
Okay.
Okay. And then once you get here, like I said, we do lab work. If you get it done that same day, then you'll see either me or Dr. Manning. Everything gets checked, and then we take you to the chemo area. Okay.
Okay.
So that's how chemo day will work for you. You have one more sheet of paper here, and this is. There you go. Got it. All right. This tells you what I'm going to prescribe you for nausea. Are you allergic to anything?
No.
No. Okay. So I usually will give Phenergan. You'll see that's promethazine. all the generic names are in parentheses because that's probably what's going to be on your bottle. All these are generic. Okay. I usually give Phenergan, and then if you go down, you'll see Zofran or ondansetron. Okay. Both of those are for nausea. You take them if you're nauseous, if you need them. You don't have to take them. Okay. Zofran, you can have that every 12 hours for nausea. The Phenergan, you can have it more often. You can have it every 4 to 6 hours. I tell people to kind of mix and use them together. What you'll find, at least I hear from most people, is one will work better than the other. You know, if Zofran's the thing that really works for you, then take the Zofran. Phenergan, if it's really the thing that works for you, then take that. Phenergan does tend to give most people that Twilight Zone kind of feeling.
Okay.
A little like you just feel sort of spacey. Does it work very well for nausea? Yes. If you're home and you're nauseous, it's going to work. But I just want you to be aware that it does have that side effect for a lot of people. So you don't drive a car, things like that, until you know how it's going to affect you. If neither one of those is working for you, we have multiple other options. So please call me and let me know. Okay. When you're getting chemotherapy, you're going to be getting lots of pre-medications and nausea medicines in your IV as well. Okay. Now the third drug is dexamethasone. That's a steroid. Okay. And you're going to take your steroids for every treatment. Each of these 4 treatments, I need you to follow this schedule. The day of chemotherapy, you don't do anything before you come. You come, you get your chemotherapy, you go home. That night, about 6 o'clock, take 2 of my little pills. Okay. Time's approximate. If it's not right at 6 o'clock, if it's 7 o'clock, that's okay. Then the next day is going to be the day you come for your new Lasta, right? The day after chemo. I want you to take 2 tablets about 9 in the morning and then 2 more at 6 at night. And then day 3, do the same thing. So those 3 days, day of chemo and 2 days after, I want her to take those steroids following that schedule because it cuts down on some of the side effects and some of the nausea that you can have if you don't take them. Okay. These are low dose steroids. People always ask me, am I going to gain a lot of weight taking these steroids? That's a concern for everybody. No, they're low dose and they're for short bursts. Okay. Yeah, long-term steroid use does cause problems for people, and you can gain a lot of weight if you're on higher dose steroids or long-term steroids. That's not the case with these. Okay. Now there's one more medicine I want to ask you if you'd like. Most people say yes. Your port. They're going to access your port. It's a pretty big needle. Yeah. So we have some cream that we can prescribe for you to numb it.
I was going to buy some because I saw some videos. They're like, you need some numbing cream or something.
You do. Okay. It's called LMX cream. Now, where do you usually get your medicines? Like, I'm going to send these other ones to Walmart for you. Okay. You can just pick them up. I'll send them after your appointment today. I'll electronically send them through my system. The LMX cream, it's going to come like a little tube. It's going to look like about the size of a travel toothpaste tube. Okay.
I think I actually have a travel toothpaste because I'm weird like that. So about this.
Yeah. About that big, and it might be a little smaller.
Don't ask why I have this.
So what you're gonna do is that part of your port that you can feel those 3 little dots. Yeah. The kind of spongy part that sticks out. You're just gonna squeeze like a pea-size amount on that. Do not rub it in.
Okay, don't rub it in.
Do not rub it in. Cover it with some saran wrap and tape.
That's why they were doing that. Okay.
And you do it for 2 reasons. It helps that absorb into that port side and it will numb it.
Well, they said not to rub it because then your fingers are getting numb.
Your fingers will get numb, and what if you don't rub it off real good? You rub your eye and then your eye goes numb. Yeah, it can be bad. All right. You just never know. So don't rub it in and then cover it. It'll keep it from getting on your clothes as well. Okay. Then when they access your port, you're going to feel the pressure of them accessing your port, like the pressure of the dentist doing something in your mouth. You know he's in there, but it won't hurt.
Okay.
Okay. Now, I give people the option. I'll be glad to send the prescription to your pharmacy for you.
Yes.
Okay. Or the other thing you can do is you can take your little badge that you have, go to the hospital pharmacy here. You do not need a prescription for it. You just tell them that you need the cream to numb your port, and it's $4.
Okay. I'm trying to think which one is cheaper. I think it's like $3.
Okay, so I'll send it. If Walmart doesn't have it, or they say they can't get it, or sometimes people have to pay crazy amounts for the medicine. I don't know why, but I've had people pay like $40 for this tube of medicine.
Oh my!
Just say no, thank you, and you just come here.
You just come here.
Okay. Just to let you know that that's an option.
Okay.
Okay. So when are you going to put that on? After you eat your breakfast, before you come for treatment, just put it on. head out the door and come right here.
Okay.
If for some reason you forget it, please don't panic. We do have some cold spray that kind of helps, but we'll get you through it.
Okay.
Any questions about any of this? It's a lot of stuff.
Hold on a second. I'm gonna make a new video.